Well, last night we heard from the Health Minister, Dr. Joe Phaahla, who has laid the blame for some of the patients that have died at public health facilities across the country squarely at the door of the striking Nehau workers. He's expressed concerns about attacks on facilities, acts of intimidation, and this morning he's just done a walkabout of Charlotte Maxeke Academic Hospital in Johannesburg. And he joins us now on the line. Dr. Phaahla, thank you very much for talking to us this morning. You've been on this walkabout. What have you seen at Charlotte Maxeke?
Well, we just finished at Charlotte Maxeke. We're going to visit a few other hospitals here in Johannesburg. The situation at Charlotte Maxeke is much conducive than the reports which I received last night. The harrowing stories of how staff members were being prevented from coming in, patients being left alone. This morning, staff have been coming in. The police are there, making sure that there is smooth passage into the hospital. So staff and patients are coming in. Then our members are at the gate. We just greeted them with the Premier and the MEC and just indicated that, we also carrying out our own responsibility. So, but they were not obstructing staff who were coming into the hospital. So staff have been coming in, and we visited the casualty, outpatients, other areas, and staff were coming in. It's a very promising day. Patients are also coming in. They're being attended to. Unlike yesterday, even overnight, the kitchen was functioning. Patients were able to get fed overnight and hopefully also during the course of today. Police visibility being a key factor, of course, in that change since yesterday. Well, remember the province, 5 provinces obtained court orders which were very specific also in terms of what, prohibiting the union from obstruction. And also ordering on the police to take all the necessary action. So that also helped. So we see a much better situation this morning. Last night at that press briefing that you gave, you laid the blame for some of the patient deaths squarely at the hands of the Nehau strikers. How many people are we talking about? We are going to get a proper figure. And that's why I didn't want to commit until, there were indications that probably up to 4 patients can be attributed in a number of hospitals just here in Gauteng. But we're meeting after, I'm entering the Helen Joseph Hospital now together with the MEC. Then we'll go to Rahima Musa after that. And then we'll just do a formal briefing later on. By that time, we'll have a reconciliation of the casualties and the fatalities. So we will be able to reconcile and give the public a better picture. We saw workers all around the country downing tools because of acts of intimidation. At Pelanomi Hospital in Bloemfontein, the workers were armed with shambox. We saw at King Edward Hospital this morning. We saw at Dorangiza in the Eastern Cape. Of course, there were incidents at Charlotte Maxeke. All across the country, these acts of intimidation were quite widespread. Nehau says, well, hang on, you can't take a few isolated incidents and paint a picture across the country. Were these isolated, or is that the general picture of the strike? Well, from what our reports indicate that it is a well calculated, move. It was, widespread. That's clearly. They did not just use their democratic right to demonstrate, but they're also intimidating and in some cases even going into the hospital premises in the wards, trying to force people to leave their workplaces. So it's not isolated. It is widespread and really well calculated by now. Could we have done better to anticipate this kind of action? Well, labor action is allowed. Of course, essential services, while generally the right to strike is part of our democratic dispensation that we expected. But in terms of the widespread intimidation, maybe yes, we should have anticipated that. But we took it that these are properly recognized unions, which are recognized they're part of the bargaining council, and they also know what are the rules of engagement when there is unhappiness and disagreement on any matter. And we thought we were dealing with organizations which also will observe their own limitations in terms of what you can do and what you can't do. But clearly, that's why we then in the next the day after this happened, we immediately moved in to take more steps.
Zola Sapeta also puts the blame on what he calls the reluctance of government to sign a minimum service level agreement, which would, of course, allow strike action to happen with essential services still being rendered.
Well, my information from colleagues who have been in the bargaining council longer have told me that has been on the table for years. But you see, and there's been disagreement because, on the side of government, when we talk about minimum service level, you want to make sure that services, patients, for instance, in hospitals can be attended to. While on the other hand, when the unions speak about minimum service level, they want the most skeleton. And that's where I'm told there's been a lot of disagreement. But in the absence of that, the law is very clear that, when you are in essential services, you can't leave your workplace, your workstation. That's the basic law of the country.
Politically, doesn't the governing party shoulder some of the blame? You are in a tripartite alliance with major, or at least most unions represented by Labour in South Africa, and yet the kind of thing we are seeing unfold with this now strike is all too common. Acts of intimidation, destruction of public property, that kind of thing. These are your comrades. Surely politically there are ways to have these conversations behind the scenes so that law and order prevails.
Well, this is not part of, what is expected within the alliance. I mean, that's on the political side, yes, but we also understand that in terms of the different roles and responsibilities, we should play by the rules. Our duty is to protect, ordinary South Africans to access public services. The unions have got the right to disagree with us where we run the government, but even there, that's why we are saying that from our side, that's why we do everything to protect the public. If it means going to court, if it means taking disciplinary action, we'll proceed to do that because that's our responsibility. But otherwise, we do expect that the very alliance partners, that they should actually also observe their side of responsibility.
Any sympathy with these workers? They were our first line of defense during the pandemic.
To the hospital, maybe if you could round up because I need to move.
All right. I'll tell you what. Let's let you go, Dr. Phaahla. Appreciate your time this morning. We do understand you need to be there. Thank you for talking to us this morning. I wanted to ask if he's got any sympathy with these workers who were, of course, as you well recall, our first line of defense during the pandemic and what it is they might be demanding now. If you're a doctor, if you've been affected, if you've been intimidated, if you are participating in the strike as a nurse or other worker within the healthcare sector, I'd love to hear your experiences and what you've been dealing with in the last couple of days.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.